Hello? Laura?
Hello, everyone. Thank you for joining us for the Data Management Developing Data Governance Structures webinar. We're just waiting for a few final attendees to join us, and then we will get started very shortly. Thank you.
Hi, this is Catherine Tout. Carlise King, are you able to hear me?
Yes.
Wonderful. Hi, everyone. This is Catherine Tout. I am the co-director of Early Childhood Research at Child Trends. I am delighted to host this webinar entitled Data Management Developing Data Governance Structures. I'm sorry for the brief delay. Apparently I was speaking to no one, so I'm sorry that you couldn't hear me when I first began. Our webinar today is being conducted on behalf of the Office of Planning, Research, and Evaluation in the Administration for Children and Families. And I'm happy to be co-hosting today with Evalise Martinez-Speck. She's the Federal Project Officer for INQUIRE and for the Data Tools Project, which is being carried out through a contract with Child Trends. Evalise will be joining us a bit later in the webinar, and she'll be able to answer any questions you have during our question and discussion period. So our webinar today is the second in a three-part series on building a high-quality early care and education data system. In our first webinar, we introduced a set of data tools that will be available within the next few weeks to support your work. The INQUIRE data tools have three primary pieces. First, they include a set of policy questions that address key program monitoring and research questions that you may be encountering in your work. These questions are then linked to a set of data elements as well as guidance on how those questions can be analyzed. The tools also include a data dictionary, which provides information about each data element. And finally, the tools include a downloadable data matrix, which can be used to sort and review the data elements. We've been developing these tools collaboratively with the Common Education Data Standards supported by the U.S. Department of Education, and they are intended to enhance but not duplicate the efforts of the Common Education Data Standards. As you will see, the focus we have in our data tools is really on early care and education, and particularly on quality improvement initiatives. Our webinar today, the Data Management Developing Data Governance Structures, is the second in the series. And as you'll hear more about our webinar, we are taking this example of quality rating and improvement systems, and we'll be using that as the lens through which we view data governance. And finally, our third webinar will be on data quality and best practices for producing high-quality data. Again, in this webinar, which will be broadcast on May 16th, we will be using the lens of quality rating and improvement systems to look at best practices. All of the materials for our webinars and the registration for the third webinar can be found on researchconnections.org. The next slide, just turning to our purpose for today. I'm not sure if your slides are off your screen. I'm not seeing the slides.
No, sorry. Actually, Laura, if you could just switch it back, please. To view your screen, too?
There we go.
Sorry about that.
No problem. So our purpose for this second webinar is to, through a number of examples, illustrate the need for and the benefits of building strong early care and education, data governance, and system-wide data management policies and practices using the example of QRIS. Next slide. And to do this, we have a full agenda. First, we'll provide a bit of background on INQUIRE, because our INQUIRE group has been the way in which we've heard about the need for more support on data, and especially data related to quality improvement initiatives. And we want to tell you a little bit about our group. Next, we'll cover 3 different components on data governance. We'll talk about challenges to QRIS data quality. We'll discuss state options for coordinated data systems. And we'll discuss data governance's role in producing high-quality data. A portion of our agenda will be then devoted to state perspectives and applications. And here is when you'll hear from 2 states, Mississippi and Maryland, about their different experiences with different components related to data governance. And you'll get to see some examples of the work that they've been doing in their states. We'll conclude with some information about our next steps, as well as an opportunity for some questions and discussions. So at this point, because Evelise has been able now to join our webinar a little earlier, I'm going to turn it over to Evelise to talk about INQUIRE.
Good afternoon. I'm just going to be brief, just to remind people that the Office of Planning, Research, and Evaluation supports a consortium of researchers and evaluators who are working on projects related to quality rating and improvement systems or other quality improvement initiatives or topics, and we call that consortium INQUIRE. The purpose of INQUIRE is to support high-quality policy-relevant research and evaluation and provide guidance to policymakers on evaluation strategies, new research, interpretation of research results, and implications of new research for practice. We are really happy that the group of INQUIRE members have been growing over the past 3 or 4 years, and it's a great venue for sharing lessons learned and learning from each other, as well as to try to improve the way research and evaluation is conducted in states for looking at the effectiveness of the initiatives such as quality rating and improvement systems. So at the end of the webinar, if anybody is interested in learning more about INQUIRE, I'll be happy to answer any questions, or you can contact us. And the contact information you will have in the final slide. So Catherine, I think that's all I want to say at this point, okay. And I'll be happy to answer questions later.
Great, thank you so much, Evelise. Through the work on INQUIRE, we have been hearing from a number of states and from evaluators about the need for support on data, and that really has been the impetus for this webinar series and for the products that INQUIRE has been developing. We've been hearing first and foremost about the need for guidance on how to organize and manage data that are being collected, and also to think about the full complement of data that are needed to address the questions that states have. There are also questions about how to coordinate the efforts of different departments and organizations that are collecting early care and education data. And finally, the need for better understanding of how to implement an effective early care and education data system that's part of a larger early childhood data system. So when I earlier spoke about the tools that we've been creating, as well as the products you'll hear about today on data governance and in our final webinar on data quality, it's really intended to support states in this need, not only to conduct research and evaluation, but even more importantly, to respond to the demands for reporting and for accountability to state policymakers and to the public. So our work is intended to support states on a number of different levels. Our presenters today include, we have a number of presenters, starting first with Sarah Friese, who's a senior research analyst at Child Trends, and she'll be providing some definitions for us about data governance. Then we'll hear from Bobby Weber, a research associate at Oregon State University, who in collaboration with our third presenter, Ioma Iruka, who's a scientist at FPG, Child Development Institute at University of North Carolina, Chapel Hill, has written a paper. Bobby Weber and Ioma Iruka have written a paper that will be available very shortly as part of this project on data governance. And through the work for that paper, they interviewed a number of States and did a considerable amount of research to think about the issues of data governance, again, using this lens of quality rating and improvement systems. And then we'll turn it over to our state presenters. First, we'll hear from Michael Taquino in Mississippi, as well as Jill Dent from Mississippi. And then we'll hear from our presenters in Maryland, Lindy Budd from the Maryland Department of Education, Chris Swanson from Johns Hopkins University, and Phil Koshkin from the Maryland Department of Education. So at this point, I will turn it over to Sarah Freese from Child Trends to start us on our discussion of data governance.
Thank you, Catherine. So before we get into kind of the heart of our discussion about data governance, I'd like to talk a little bit briefly about what we mean when we use this phrase, data governance. It's kind of a concept that can be used somewhat differently depending on context and situation. And so it will be important for us to sort of establish a shared understanding of what we mean when we talk about data governance, specifically for QRIS. And I'll also, as Catherine said, review some additional terminology that the other presenters will be using so that we can make sure that everyone has a shared understanding of those concepts as well. So what is data governance? You can see here that in this webinar, what we consider to be data governance are the set of business policies, processes, and data management practices that provide guidance on the use of a single data set or a compilation of multiple related data sets. Governance promotes systematic data usage through adherence to uniform data quality and confidentiality practices. So kind of taking this definition, you can sort of see how data governance isn't necessarily a static or concrete thing. It's more of an ever-changing set of rules and structures that are meant to support effective management, usage, and creation of high-quality data. So governance supports a lot of the real on-the-ground activities that data managers and program managers are engaging in, and helps to facilitate collaboration between these groups. And that collaboration can really lead to improved service delivery for program managers, and will help data managers meet best practice standards for data management. So on the next slide, we talk a little bit about what data governance means for the field of early childhood. So early childhood data is frequently collected by different agencies and organizations. It's often housed in different data systems and data sets, and it's usually collected and managed using different sets of rules depending on where it's housed. So this type of decentralized data structure really leads to few commonalities between the data being collected. And though that lack of commonality often inhibits the sharing of data that can lead to improved service delivery and ultimately also improved outcomes for children. So one of the many benefits of establishing strong data governance procedures and structures is that they promote data sharing, and that data sharing really provides policymakers and practitioners with the kind of information they need to adequately assess the interventions that are intended to improve children's development and their readiness for school. So you can see on this next slide, we sort of have a graphic of how QRIS fits into this larger world of early childhood data. So QRIS systems and QRIS data systems are pretty much embedded within these larger systems. They're embedded within early care and education data systems, which are themselves embedded within early childhood data systems, and which are themselves embedded in these kind of larger statewide data systems. So in this webinar, we are really going to be focusing specifically on QRIS data governance and just kind of keeping in mind that QRIS data is really highly interconnected with all sorts of other types of information that are collected about young children. So before we get into the specifics about QRIS data governance, on these next two slides, we have some terms that you might be hearing some of our presenters present, and this will give you an idea of what we're talking about when you hear these terms. So a data set is a collected set of data elements that are collected for one program or one purpose. So an example of a data set might be a child care licensing data set that's housed within a Department of Human Services, and that would typically be considered one standalone data set and would be made up of multiple data elements. A data system is a collection of related data sets that are housed and managed by the same department or organization. So kind of building on that licensing example that I just gave you, if our generic Department of Human Services also manages a data set with child care subsidy information, that data set along with the licensing data set would form a data system, along with any other data sets that they manage that have data about young children and their families. So on the next slide, we have a couple more terms, and those terms are coordinated data system and integrated data system. Now these are very similar terms. In both of these types of data systems, there are a number of data sets and data systems that are interrelated to promote data sharing. They're governed by a same set of rules. So in each of these cases, there is a data governance structure. It would, for our example, for this webinar, include QRIS data systems or data sets. An integrated data system goes one step further than a coordinated data system in that there's also a body or a group of people that exist at the state level that's a central group, and they provide data management services like matching of individuals or families between data sets and the creation of new data sets that include data from individual data sets across organizations and departments. And so with that introduction to data governance, I'd like to turn it over to Ioma Iruga, who will be talking about the challenges to data quality and governance in QRIS data systems.
Thank you so much, Sarah. Appreciate that. So I'm going to talk with you about sort of when Bobby and I started this work, we started with talking to a lot of states and several state data administrators. And so I'll talk with you about the key challenges identified, which many of you may likely resonate with many of you. And the challenges are not presented in any specific order as well. So, and think about the challenges. I don't want you to get hung up on the challenges, but also knowing that the latter part of the talk, as Catherine highlighted, will focus on specific applications about addressing some of the challenges that we found. So the first challenge is that states use data from data systems administered by multiple agencies and organizations, as Sarah just noted. So quality and improvement systems are generated usually by drawing on data from a variety of sources. For example, states may need to use data from its child care licensing system, state pre-kindergarten program, Head Start, and the workforce professional development registry to inform their QRIS rating. And even in some cases, they may even pull data from subsidy, which may not go into the rating, but it may go into sort of the subsidy reimbursement rates, for example. And there are also other things such as technical assistance and quality improvement data that may actually be part of the QRIS. So many states take different approaches on how best to handle this challenge, and we'll talk about that as well later. So challenge number 2 we found in our interviews with states was the whole idea of linking data systems, because usually of the differences in design and practices. So for example, licensing databases typically include data on facilities such as location, capacity, etc. While on the other hand, professional development registry databases typically contain data on demographics, qualifications, credentials, and training of the workforce in the facility. So these two databases have important information, but for very different reasons. Therefore, it's important to understand the purpose as well as the ownership of databases from other agencies or other state or local systems, and the limitations that may result. So in some administrative databases, data may only be collected for data elements that are essential for the work of that particular agency. So for instance, you're collecting only information about a facility, or you're collecting only information about a workforce individual as well. So data elements are discretionary and may have no implication for funding, so you may not focus on that particular data in your data system. And this may result in missing data for a number of elements, and this is particularly critical for QRIS who depend on other data systems for their information. Some other challenges we noted within the whole linking is that such as some data systems may override previous records. So you may have something information about a facility from 2 years ago, but then when you have new information, you delete that information from 2 years ago. And so you will have no data about that particular facility. And similarly, the same thing with TA or other information. And so if you're trying to link data, you may have missing information because it was overridden by new information as well. So a final issue with linking is that each agency organization has its own method of data representation and record identification. So for instance, how you do identifiers, at what level, whether the child level, facility level, program level, teacher level. So everybody may have their own way of determining identifiers, and that may not be compatible when linking data as well. So all these differences in database design and practices increase the opportunity for errors when you're trying to link databases. So a third challenge we also found is that data practices often don't support high-quality data. And this is not really to blame specific individuals or systems, but to really raise awareness about the critical importance of data practices, particularly when you have sort of high-stakes accountability like the QRIS, for example. So data integrity really begins in data collection processes, which we're not talking about in this particular webinar, but something that should always be considered. In some states, data are collected by multiple agencies, and they have no common policies or documentation about how data are entered and stored. States are increasingly using web-based systems for data entry and storage, and electronic linking is becoming more common, but some states still move data manually from one database to another, either through manual data entry or through merging data files. But most states we still find are limited in having technical manual describing how data is merged or detailing various procedures to ensure high accuracy as well as low errors as well. So even with the shift towards web-based systems, there are still challenges with states ensuring high-quality data because of sort of the limited documentation about procedures. And so think about it. If somebody leaves a particular set of human services, that person who was in charge of the data may take all that information with them. But when there's no documentation, that may not have such a big impact. And so there's still limited documentation about procedures and policies to ensure data quality and security. A fourth challenge we identified in talking with states is a lack of governance. So here is the crux of our conversation today. The lack of governance framework for early care and education data systems and management, and QRIS in particular. So a critical challenge for QRIS in particular when seeking to pull data from multiple agencies is that many states do not have established authorities that govern and manage the policies and practice of ECE data systems. So even when a single state agency controls funding for all the programs whose database are used in QRIS, each database typically has its own administrative structure with authority for how that database is managed. So there are concerns about whether there are clear and well-articulated process about how databases are managed. So even within sort of a human service agency, when there are different organizations controlling that, they usually don't have sort of this governance structure about how data would be managed and secured. Further, in many instances, individuals enter data as part of their many duties without clear guidelines on how data should be entered, merged, checked, or stored. So states that have individuals assigned to manage the data are more likely to have in place up-to-date procedures and documentation that ensure high-quality data for their QRIS. But without an ECE data governance system, these procedures are likely going to differ across agencies as well. So hence the importance of common data standards and well-articulated data management practices for all ECE organizations, agencies, programs, etc. So the end of it is that there may be a chance that without this governance structure, QRIS and other state systems may be using inaccurate data. And the final challenge we noted, which in the end of it probably is really an opportunity, is that many states are designing or redesigning their QRIS data systems and are really looking for models and guidance on best practices, which is probably why this webinar and similar webinars are really well attended. So while some states are building their first QRIS data system, other states are redesigning their QRIS data system by improving automation or adopting a web-based platform. So many states are becoming more web-based as a way to facilitate linkages between and among databases and to be, sustainable over time while ensuring high-quality data for the QRIS. So as their systems are changing, states are finding challenges in determining the optimal data system for their state and as well as the structure for this data system. So this period of rapid change is an ideal time to support states in building QRIS data management capacity. So these 5 challenges that I've presented are not intended to bash data systems, but to really shed some light of the major challenges faced by many states when it comes to ECE data systems, specifically QRIS in particular. And this is particularly important because of the high stakes of many of the systems, such as rating points that determine your reimbursement rates or award that you may get, or in some instances could also impact sort of whether your program stays open or you have a job. So there are financial and life implications potentially if we don't begin to address some of these challenges. So now I will turn it over to Bobby Weber from Oregon State to talk with you about options for data systems to address some of these challenges that I've highlighted.
Thanks, Ioma. So in a lot of ways, what QRIS has done, I think of as 2 things. One, we've all long wanted early childhood to be one system, and in a way, QRIS is making us move there maybe more quickly than we would have planned. So building QRIS moves multiple data systems into relationship with one another. And a central component of QRIS is this coordination of multiple databases. And as Ilma has pointed out, producing accurate ratings from these multiple databases is critical. So there are 4 basic types of coordinated data systems with benefits and drawbacks associated with each. And each state is going to need to decide on the best fit for them. But we're going to go through the options and show how they vary on these 4 key characteristics. Data quality refers to the accuracy, completeness, and currency of the data. Availability describes the ease of access to the data for those who need it to carry out their responsibilities, whether that's technical assistance or doing a rating, whatever their role. Efficiency describes how work flows across agencies, and governance will determine the quality, confidentiality, and security, and how efficiently and effectively the data system supports QRIS in its purpose and goals. So we're going to take each one, and now you see a graphic describing these 4 basic data system options and showing how well each option meets the both quality and efficiency criteria. Unlinked data sets or point solutions provide the lowest quality and least efficiency, while a fully integrated data system provides the highest levels. We will now go into more detail on each of these. The next slide shows the unlinked databases or point solution. Unlinked refers to freestanding databases used by agencies to carry out their work. So licensing has a database, subsidy has a database, workforce has a database, the people doing the quality observations have a database. A point solution or point product is software that is designed to solve a particular problem without regard to related issues such as the quality of data within each of those source databases. Point solutions are widely used to fix a problem or implement a new service quickly. Source databases such as licensing, workforce, measures of quality operate independently, and the application or point solution pulls in data and uses it to perform desired functions such as producing ratings or reports. In this model, governance occurs at the agency level for each silo, each database silo. Although this option is the least disruptive in the short run, which is its major benefit, it will produce the lowest quality data. It's also the least efficient and most expensive in the long run. So now we're going to talk about coordinated or linked systems. In this model, each database silo is linked one by one to its complementary database. So licensing and workforce are linked so that every member of the workforce who works at a given facility is linked to that facility, or vice versa. Typically, data are not based on standards, so quality may be poor. Maintenance is high. Access to data and data sharing are limited to just what that one application can do. Governance occurs at the agency level still, and sharing is addressed on a case-by-case basis. So it's sharing for a special purpose. So the next model is sometimes called federated or shared database system. It keeps components of databases autonomous, as in the other models. The data elements needed by QRIS are extracted from the source databases. Then they're mapped to standards, linked to master identifiers, and stored in a shared repository. Data are available for cross-agency needs after they have been shared. Not in real time, but after they're pulled together. Cross-agency governance is required for shared data, but agencies would likely continue to maintain their silo governance processes. Redundancies still exist as the data is entered into more than one database. The sharing system does require some maintenance. So now we're going to look at an integrated data system, or comprehensive or integrated, in which all data elements needed by QRIS are addressed in a single integrated data model. This option reduces redundant data entry and other redundant workflow. When a value is entered in the database, it's then available to all the partners. Data are represented according to standards, so quality is high. Data are available for all needs as soon as they are entered. Governance includes stakeholders from all participating agencies. The major drawback to an integrated data system is the investment of time and resources. This option requires partnering agencies to make changes in the databases used to carry out their role and function, their responsibilities. The payoff for these changes is great. They're going to have more information. It's going to be more accurate, but it takes time and resources to get there. So now we're going to talk about governance, which is essential no matter which of these four options is right for a state. Governance is where stakeholders come together to make decisions about what the vocabulary will be, which nationally recognized standard will be used for its representation, and who will have permission to access the data. No matter which option is right, governance is essential for producing accurate ratings. The accuracy and reliability of our QRIS ratings is closely tied to the efficacy of our governance policies and practices. So the next slide shows a typical governance structure. It involves multiple components, the highest of which is an executive council that sets the mission and goals, secures funding and other resources. The goals for the data system are the same as those for the shared endeavor. So if you're building a QRIS data system, that is those goals are not different from building QRIS. They're one and the same. The data system is an essential tool for goal attainment. The other bodies, the other committees in your governance structure make sure the work gets done through their actions. Feedback from partners and stakeholders is a vital part of governance. Data systems need to work for the people who are entering, accessing, or analyzing the data. Stories abound of expensive data systems that could never be fully implemented because they were not built upon an understanding of user needs. That's a sorry thing when it happens, and so the feedback is an extremely important part of governance. So in the next slide, we describe some of the tasks that are conducted by a governance body. So this is a description of best practices. So I think it's helpful to think of this as a list, and in the paper they're more fully developed. But the first one is to produce a standard data sharing agreement that can be used by all partnering organizations. And a second is to ensure that documentation includes information on all variables in the data system, including how summary variables are generated. This will require cooperation from all partners whose data is shared. It is common that agencies have not documented their own data, or they at one point had a code book or a dictionary that was complete, but given the size of workloads in early childhood, they haven't been able to keep it current. And it's going to be critical for the accuracy of QRIS ratings that we overcome that and are able to document what each variable actually means. That moves quickly to an issue that Ilma described so well, that it's common to override data when doing updates. But that means that you don't have a history. That's one problem. The other problem that comes up is then you assume that you know what a variable stands for, but actually a year earlier it meant something different, but because this hasn't been documented and that value is now gone, you don't have history, you don't have values that you think you have. So documentation and not overriding and having policies that support this are important. And then following right beyond that is that you ensure that data are saved, and that system changes because they happen. They do have to happen, and so we need to have ways for capturing these so we can see so data can remain accurate over time. Developing common data standards. There's multiple standards involved in data management. There's vocabulary standards that include what an element means and how it is represented in the database. But there are also standards regarding security, privacy, access, and as we've referred to, change. So all of these common standards need to be very clearly articulated. Yoma also gave real-life examples of issues related to unique identifiers. Rating information can be lost because the identifier was not accurate, and therefore that information doesn't get attached to a facility or a workforce member. It's very critical that we have a unique identifier for every child, every workforce member, every facility. There might be multiple identifiers, but there has to be a unique identifier that can link each one of those to the one that's going to be shared, and that is going to be consistent. And flowing from all of this is the need to train data management staff. We need to invest in these people. It needs to be shared training for anybody who is working in data that's going to be used in QRIS. We need adequate support for data managers, doing things like documenting and all the kinds of checks that need to be done by the people who are actually managing the data. And finally, we need consistent security and backup policies, which include determining who has access and what level of access to the data that different organizations and individuals within organizations are going to have. Both data system options and best practices will become a lot more clear through the state experience that will now be shared by Mississippi and Maryland.
Carlise, this is Mississippi. Should we begin?
Yes, go ahead.
Go ahead.
Okay, great. Well, this is Mike Taquino. I'm at the National Strategic Planning and Analysis Research Center at Mississippi State University. Unfortunately, many of you probably know Dr. Mimo Parisi. He wasn't able to be on today due to a series of meetings. So myself and Tia Merrill and Yanding Tang, we are part of our early child care kind of technical operational team here in the state of Mississippi, are on the call. And also Dr. Jill Dent from the Department of Human Services. She's the director of essentially their early care and education division is on the call as well. And what we thought we would do today is give a little overview of what we have going on in Mississippi using a recent project that we've been partnering with the Department of Human Services on, and Jill Dent, as one example of how Mississippi has approached the issue of data governance and building a system in order to conduct research, to track outcomes, to evaluate intervention strategies, whatever the case might be, and in particular also to improve quality ratings of child care centers, and then look at subsequent impacts on actual children who have come through those systems and continued on into the K-12 system. So what we thought we would do is first, Dr. Dent was going to give a little overview of what has been going on in Mississippi in terms of this particular project and how it fits into the larger scheme. And then for more on the technical side, I would go through, along with the rest of the Mississippi State team, go through some of the process that Mississippi has used to address questions related to quality rating systems.
Thank you, Mike. One of the things that was really important to me when I came into this position was to be able to help child care centers be successful in the QRIS system. And one of those things was to be able to really know what was going to help child care centers increase their scores and be able to move up in our QRIS. So one of the things that we did was created Allies for Quality Care. And within that, we put into place intensive technical assistance within the classrooms, a technical assistance person to help the director with their business needs, as well as someone to help the cook supply nutritional food to the children within the center, and then materials as well. And so in implementing that whole program, we essentially wrapped our arms around the child care center and gave them reinforcements to be able to help them succeed with the program. And so while we did that, during all of this time we were collecting information, and we would just, as soon as we would collect it, we would upload it into the system, and we would try to get all that information all the way down to the educational background of the staff and all kinds of supporting data to be able to give us what it really took for these centers to make a difference in the children's lives, as well as being successful in their business. One of the things that we required when we went into this program with the providers was that they were cooperative with allowing us to come in their center and allowing us to collect this data. That was one of the components that they agreed to, and they were very cooperative, and the data collection went pretty smoothly. You know, there was a little bit of a period where we had to affirm that we were not going to share the data with anyone else, and it was not going to be on a per site or a per child basis, that we would use the data in an aggregate form so that we could definitely be able to see what types of influences we could make in our system to be able to help centers move. And actually what we were seeing was pieces of outcomes from, for instance, the ITERS and ECHR scores, things they could definitely make changes and get immediate results. And there were lessons learned through this project. You know, we put some money into supplies, and, you know, through that process we found out that that really didn't increase their score that much. It was more of interaction, and it was more routines and things that they could do at that moment of learning the information that we gave them from this data collection, that they can make a difference in their center immediately. So, you know, it also helped us to be able to see through the data collection the targeted training we needed to do. It helped us adjust our technical assistance as well. So this data collection has really benefited the child care centers in a more immediate way than I thought would have really impacted them before we started this program. So we really have made a huge impact on these centers and have moved them further along than I thought that we would have in the 1 year that we have worked with them. With this program, we stay with them at least a year until they move their ITERS and ECHR scores up to a level 3, so that we can make sure that they're at least at that level before we move out of that center. So I'll add more information if you need me to, Mike. But I think that's a good foundation for us to get started with the consideration of for allies.
No doubt, Jill. I think that's great. And as we go through the rest of this, just jump in whenever you're ready to add a little more context to it.
Sure.
And we can go ahead and advance that next slide real quick. And we'll go through a lot of this. I know we'll go through a lot of this. We won't spend too much time because some of it is a little bit of what has been talked about before. It's more of an application here. In Mississippi, a model has been put in place, developed and put in place here in Mississippi. That really it's been about a 10-year, maybe a little longer process in general in Mississippi to develop a process to share data across agencies, across programs, to link that data and to actually be able to do some pretty sophisticated reporting. So Mississippi has been working on this idea of a longitudinal data model or an integrated data model for really since about 1999-2000. So it's been underway in Mississippi across workforce and education and early care and education for a pretty significant period of time. And what Mississippi operates under is essentially a series of 6 building blocks that have really led to this ability to have integrated data governance and a model that's actually actualized to collect information and conduct reporting. In this case, we can talk about the quality rating system, and in particular in the work we've been doing with early child care partners. If you go to that next slide. So we have 6 main pieces that have been put together in the state and that have been really useful in making sure that we had a successful system and to continue to expand that system. The first piece is a scope. You have to have a reason for sharing data. You have to have a reason for a purpose for actually having a data system. Without starting with that purpose, with that vision, with that overall goal of what you're trying to do, then it's real tough to end up with what you need, obviously. And an example here that Dr. Dent just discussed here to address the effectiveness of intervention strategies in quality rating and in the success of child care centers. And the overall goal was to support child care providers to increase their quality, essentially, at the end of the day. Do you want to go to that next one? Once you have an overall scope and you know what how you're going to proceed with this, then you have to make sure you have the right people at the table. You have to make sure you have the organizations, the programs, the agencies that need to be at the table to discuss this process of data sharing in whatever form it's going to take. And that obviously has to be directly aligned with the scope of what you're trying to do. So data stakeholders related to the Allies for Quality Care program include the Department of Human Services, the Department of Education, Head Start, and the Mississippi Department of Health. And this really helps set up a longitudinal process that as the system is developed, as more data is collected over time, you can really start seeing long-term impacts on it. So having those data stakeholders identified is absolutely key. The next slide, the third main element is application. That the data, the definition of what you're going to do is only for activities directly related to the scope. And here you really have to, in Mississippi, we really focus on starting to flesh out that process. What are we really talking about in terms of data at that point? First, you have to determine what data is actually available, what data is out there. This comes from working with the data stakeholders tied in directly to that scope. You have to go through a process of documenting the data, which is definitely a time-consuming task. Actually, all of these pieces can be very time-consuming. To develop data dictionaries, develop code books that specify what those fields are, how they're coded, all of the detailed technical information that's going to be needed to really develop a good mapping of the data. How different programs are going to map together now. You know, as was discussed earlier, there's a lot of duplication oftentimes. And if you're dealing with a data warehouse that's going to pull already collected information in, as an example, then you need to have those mappings done so that you know how fields relate to each other, how they're coded, where are those alignments, how can you develop an overall data system from that. Then a fourth element there is the mechanism to actually access data. You know, this repeats a little bit of what was discussed before, but there you have files that are saved in separate environments, and you're going to pull in for kind of a one-point query. A data warehouse that's set up that's based on an overall logical model. And in this case, you have actually linked logically programs based on the information that's contained in them. Centers, classrooms, the teachers, the students, all of that information linked together logically based on the common identifiers that are present. Or if you have a federated inter-system exchange, how that process will work in terms of reaching out to other systems and pulling their information in. This is the application process that's been done in Mississippi. Doing this up front is absolutely crucial to make sure that by the time you get to the end point, when you're actually accessing information and using data, that you have gone through all the steps and the checks and balances to make sure you fully understand the programs and the data that you're going to be working with. Do you want to go to that next slide? This is really where the meat is. So once you know what you have, you know why you're going to do what you're going to do, you get the right partners to the table, you know what information you have to work with, then you really need to get focused on actually building that expertise to conduct the study or build the data system. In this case, you need to secure the data and access the data. And there are several main components to that. In Mississippi, what the state has done is partner with and develop a center of excellence, is what we call it. And this is really becoming a fairly common model throughout the nation now, drawing on university expertise to help develop these types of data systems, to help conceptualize scopes, and and really to help conduct studies and analysis. Universities are a fantastic option in that. And INSPARC has been able to serve in that role with, by partnering with the state, whether on the education, early care and education, or the workforce work that we've done, to be able to play that role as that kind of that technical expert in the process. And so you need to establish the data technical and research expertise. In order to have data sharing right up front, you need to, first and foremost, you have to make sure you have built the trust across agencies, across programs, even within agencies, to share data, to the basic trust that it's going to be used as it's intended, that confidentiality is going to be protected, that any federal regulations, FERPA or HIPAA, are accounted for and addressed, and any work that's done is done within those guidelines as well as within agency guidelines. Having that trust up front, that's always, sometimes it can be a challenge to build, but it's very important that you have this culture of cooperation that's established. And that's what all parties in Mississippi have worked to establish, is that culture of cooperation across agencies. And that's been really the backbone before anything else, before formal agreements, having that culture and that desire to use information to try to make the best decisions. Once you have that in place, obviously you have to have the legal expertise. You have to have the actual legal documents in place that allow this kind of sharing to happen, and make sure that all procedures are actually specified. It's fantastic to have trust. It's fantastic to have the culture of cooperation. Those are necessary elements, but you also have to have the legal side of this in place. And you have to have the formal agreements in place, memorandums of understanding, these types of things that specify how data can be shared, how data can be used. And in Mississippi, the primary focus has been making sure that the agency, that the data owner retains ownership, and that the any clearinghouse or central repository is a steward of that process. And so those ownership requirements are very key to the success of this. The last element, the fifth one, is having policies and procedures to really ensure that data is, from actual transfer through access, is managed the way it needs to be. And whether you're dealing with a data warehouse model or a federated system, either way it's going to operate in a very similar fashion. First, you have to have processes for transferring data securely and safely. You have to be able to inventory that data and understand everything that you have. Go through an extensive process of data validation. I think the discussions earlier about data quality and working to improve data quality is crucial in this process. And so there has to be a process of going through a validation procedure to ensure that the data that you have have been reviewed and audited, and that there's a kind of a back and forth, formal, semi-formal relationship of reviewing and cleaning and editing data on both the center of excellence, so to speak, on that side, as well as on the agency or the data stakeholder side. Next element is actually de-identifying, anonymizing data. Whether it's a federated system or a data warehouse, you have to ensure that identities are protected. And that's whether or not, even if whether you're using individual level, student, child, workforce information, or center level information, protecting those identities is crucial, and having a process in place to do that is key. Then the last element of this process is the actual data access. Once you've gone through all these steps, and you have your scope, and you have your stakeholders, you have defined the application, and you've mapped the data, and you have gone through all the process to ensure that data is collected as accurately and is cleaned and has been validated as best as possible, has been de-identified, then you're ready to actually produce the information. And of course, that's all tied back in directly to what the scope of the overall system is. So we can go to that next slide now. And there's a number of ways, obviously, to actually package information that's coming out of a system. Technical reports is one side, and as part of the Allies for Quality Care program, Phase 1 actually, and Dr. Dent can talk more about that, Phase 1 has been complete for this particular effort, and Phase 2 has come online now. And so Phase 1 is in the process of being evaluated. You know, the basic way to generate information is through technical reports. You have all of your data, it's all linked and has gone through the process, and generating those reports on actual outcomes before and after intervention in this case is pretty straightforward. And that's actually, unfortunately, I had a slide for that, but I think we had a little bit of a glitch with it, so it's not there. But as Dr. Dent mentioned, this intervention strategy for this particular program, for this effort, has actually showed that it has very positive results. So it's fantastic to be able to see that. The other way you can look at packaging information is through the online web portal. And that's what Mississippi has created. Currently, if you want to click on that link there, the live tracks, if you click on it, it should take you to the web. Or you may already have that up, I'm not sure. Just wanted to show just briefly how that kind of that end of pipeline process works. Is that something? Yeah, there we go. Okay, live tracks. That's what Mississippi has put together. And I'm not going to go into detail in it because I know we have a time constraint. But you have an early childhood component, a K-12 component, community college, university, through the workforce. And this actually links all of that information so that individuals at an aggregate level, their success and their information can be linked across time. If you want to just click on K-12 real quick, currently the early childhood portion of this is being built, so it's not active right now. But if you look at the K-12 process, just click on all students if you don't mind. And you can click on, how about student progress? Run report at the bottom there? Yeah. So this is Mississippi's K-12 system here. And if you look at the, if you go and you can look at that, for instance. That's looking at grade level retention over time. So going from the kindergarten through 12th grade. So using a linked data system such as this, you can actually start identifying how students are tracking through the educational system. Other reports here look at their progress through college, their how well they do on standardized tests, what their workforce outcomes are. So it has all of this information linked. We're also doing the same thing on the early care and education side. Another example is with Head Start. Some recent analysis we've been doing that actually probably will come out as a publication has been looking at the fade-out effect for Head Start students. Those that receive Head Start services, those individuals are linked through the K-12 system to see how well they do compared to their peers based on their special education status, their retention status, if they're retained or not, as well as their standardized score assessments. And there we actually found some really good results for the Head Start program. So because of being able to link data in this capacity, we're able to evaluate programs such as Allies for Quality Care, such as Head Start impacts, as well as a variety of other things here. So this is really what Mississippi has been building as part of that grand state vision to pull this kind of information together, to link this data, to be able to answer questions that would not be possible. And so there are a lot of reports in here, but I know in the interest of time we won't, that'll take us a little off track. So we can go ahead back to the presentation. I think there was just one more slide there, the next one. Okay, the final two pieces are leadership and accountability and sustainability, and these are definitely not to be minimized. Who is going to oversee the system? What body is going to oversee it? How do you keep this on track the way it was intended is really key, and having a board that's going to do that is really important, as was discussed before. In Mississippi, we have a governing board that really provides that one point of leadership and accountability. There's a management team that provides more of the technical, operational advice, and then an actual center that will continue to provide. In this case, currently in Mississippi, it's INSPAR that provides the the research and the technical capacity to maintain the system as well as conduct research as that process is defined. Mississippi also has a governance process that handles how requests are made and how information is produced. So a process to be sure that if there is a request for early care and education analysis based on this data system that's been developed, that request is handled appropriately so that all parties remain involved, all data stakeholders remain aware and retain the decision-making authority on how studies are designed and produced. So having that process of leadership and of accountability, and at the end of the day of management is really key to make sure, and having all the intricacies worked out. It's time-consuming again, but having it set up in a correct way will really make a sustainable system. In terms specifically of sustainability, in Mississippi, this data sharing process and the system that's been developed has really three main components as far as those legal efforts for sustainability. One is the memorandum of understanding with all partners that are involved, and having those in place is the backbone of the system. The second is that we have a governor's executive order allowing this to happen in place. And then the third aspect, which actually just happened, is that we have a legislative appropriation now in place that actually provides some funding for the system to operate, which was really crucial to happen in Mississippi. We've had an SLDS grant with the, one of those that came out of the U.S. Department of Education is winding down now that has helped fund part of the development of the system. And now having actual legislative appropriation funds in place is really was really a crucial step to make sure that the Mississippi system continues to remain sustainable. So these are those 6 elements that Mississippi has used, that all partners involved have used, that we've worked really closely with the Department of Human Services, Department of Health, and Head Start as our main as the main early care and education partners in this process, that have worked to put in place to make sure that we can actually do the good work that Mississippi is doing now. Dr. Dent, do you have anything else you'd want to add?
I do want to say one more thing about accountability. All of the work that we do here in the state, the majority of the funds we have for early childhood is federal funds through the Child Care Development Funds, and those are, the ACF is looking at all of those funds, particularly in the quality setting, and this system is really going to be able to help us show and be able to help us with the accountability portion of the work that we do, and be able to really help with our own evaluation of the projects that we're working on to decide if, they are giving us the outcomes that we want for the projects that we're looking at investing in the future.
Thank you so much, Mississippi. We really appreciate the wonderful example that you've provided for us. Let's turn it over now to hear about the Maryland Excels project.
Hi, everyone. My name is Lindy Budd. I'm talking to you about Maryland Excels, which is our QRIS. And in Maryland, we're fortunate that almost all of our programs are in one agency, which is the Maryland State Department of Education, and specifically the Division of Early Childhood Development. So we're literally under one roof here. So for the most part, we started with pretty much an integrated system, so that much of our data is pulled from existing data that already was available within our state agency. Maryland Excels is the name of our QRIS. It stands for Excellence Counts in Early Learning and School-Age Care. We are finishing a pilot and will be going statewide for opening to everyone to participate this July. So this slide gives a little overview of where we are now in the process. Since 2001, Maryland has had a tiered quality rating system, but our participation rates were extremely low. So in 2009, we began a process of revising and updating the system with a large and very diverse group of stakeholders. And in 2011, we were fortunate to form a partnership with Johns Hopkins University Center for Technology and Education to continue the development of our standards and processes and for creating our online system and website that is now known as Maryland Excels. So the next slide gives you a little snapshot of what the homepage for Maryland Excels looks like. And this includes the ability for families to search for participating providers in their region and provides an orientation both to child care providers as well as communities and families to learn more about the benefits of Maryland Excels. So now I'm going to turn it over to Chris Swanson, who is here from Johns Hopkins University Center for Technology and Education, and he will tell us about the data that feeds into and out of our QRIS system in Maryland.
Great. Thank you, Lindy. Good afternoon, everybody. If we can go to the next slide, we'll see an overview of the Maryland Excel system. And as Bobby mentioned, we fall on that spectrum of data system types as a coordinated or federated model, though we are working towards being an integrated system, and in fact, some elements of our system are integrated. So if we can just go to look at one specific element, and then we're going to come back and look at each box one at a time and then put them all together. Right now, just at the top left, the Maryland Electronic Licensing Inspection System. So this is an example of where we are linking to data that's already out there that's helping to aid our Excel system, and then conversely that we feed back in terms of actions related to Excels back into the main early childhood data warehouse. So our licensing system, as was mentioned earlier, includes things like capacity and inspection results and licensing status. We pull a real-time connectivity to the Excel system because quality rating is contingent upon being in good standing without a suspension or revocation of your licensing status. Now we're going to look at the next grid and the chart, which will take us down to our comprehensive assessment system. Now, Maryland is one of the Race to the Top Early Learning Challenge Grant winners, and in addition to enhancements in the expansion of the QRIS system that was already begun prior to the ELCG, the state is revising their kindergarten entry assessment into a comprehensive assessment system. So these data will be able to tie into specific children's performance on this comprehensive assessment system, which is available to children from preschool 3 up through kindergarten. That includes things like developmental screening, a formative assessment, and a kindergarten entry assessment, all of which are linked through the early childhood data warehouse and then are combined with the quality level of a program to be able to longitudinally look at outcome scores. Of course, we're in a field test phase, as Lindy mentioned, just getting ready to move out the census, so we're looking for a stable platform before we draw any final conclusions about that. Looking to our next grid, it's going to take us to our Child Care Administrative Tracking System, or the CCATS. Now, this is where we see the emergence of an integrated system. So the State Department uses this system that's been in play for a number of years to connect as a single point of entry a number of disparate data sets and things like credential levels of staff, certainly demographics, information about our food and nutrition program, the child and adult care food program, which are all data elements that the Excel system requires. Below that, you'll see the electronic attendance registration system. This is a new system that's being built. If we could click one more time, please, to be able to track child data of attendance, to be able to make the association of a child to a given teacher, that teacher to a given classroom, that classroom to a given school, but then again feeds up into the CATS system into a single point of entry, which all feeds into, and if we could advance one more time to bring up the Excel's grid, into the child data warehouse that then combines with the specific information that's being generated by Excels, things like program rating level, key staff demographics, national accreditation data, as well as Maryland has a homegrown accreditation system, and then our ERS scores. Additionally, we also have class scores that we're entering for our validation efforts. And then one more click will bring the whole thing back into focus. And the key piece here, it's getting back to some of the elements that Bobby mentioned about our data quality. So though we are a federated or coordinated system, we are trying to reduce the redundancy of data entry and to get to single points of truth, that data is pulled from one system and then verified and actually fed back, so you don't have to go and do double entry to reduce those data entry errors that can occur in those situations. On our next slide, we're going to take a look just at the specific data elements that are captured within Excels. So on the right of your screen, you notice a screenshot from our system, which Lindy mentioned Hopkins helped to build for the state. The way, just a quick orientation to this, you see the green checks at the left-hand side. The way to read this is when you see a vertical alignment, so going up and down, if you have all your checks in a row, that is the quality level that system, or I'm sorry, that program has attained. Now, they may have evidence towards other domains, which we have our 5 domains. And for example, you can see in rating, scale, and accreditation, this program has all 5 checks completed. In Maryland, a check is equivalent to a star in other states. But because of their staffing and professional development, they're still at a check level 1 until they can demonstrate enough evidence to move up. We use a 2-pronged process in our system, both a system verification of data as well as a reviewer verification. So things like credentialing and licensing, because they are aligned and coordinated with those other systems, we're able to bring those data in, give credit, and then move on. But things such as developmental appropriate practices, where we're looking for specific demonstrations of family engagement, effective lesson plans, good adult-child interactions, programs are prompted to submit evidence that's then reviewed on a 2-tiered approach, once by program coordinators who are with Johns Hopkins University, whom we've trained to reliability, and then on a secondary level by quality assurance specialists who are hired by the State Department, who make the final determination before that quality level is published. And that's how it will be moving forward once we're into our Census Administration this July. The types of evidence that are submitted is completely tracked, so we maintain all data, including legacy data. So Bobby had mentioned before, one of the challenges of ensuring that you don't override your data and you're not losing data. We maintain all cycles, as we call them, which is the date that somebody has received a check quality level and the date that expires, which is 1 year from that date of attainment, unless they've either advanced to a next higher level or demonstrated that they're able to maintain that current check level. We're able to track all levels and degrees of communication between reviewers with a program, between reviewers to each other, as well as to state data managers. And then we're able to look at the specific artifacts and evidence that have been submitted. So as we go back and review all these data from a validation standpoint, we're able to really ensure the integrity that we're sticking to our data standards of what constitutes a quality level. On our next slide, you'll see that there are some specific questions that we're seeking to address with this structure. In Maryland, we've had a K-12 longitudinal data system that Johns Hopkins had been a part of establishing years ago, and we are seeking now to combine the early childhood data with that through a single interface as part of the bigger race to the top. And we'll be able to look at the longitudinal impact on school performance by an early care experience. We're particularly interested in seeing any correlations between quality elements. So as was mentioned earlier, there are a number of overlapping initiatives, from accreditation, credentialing, environmental rating scales, program administration, business administration scales, etc., where we can look and see demonstration in one area, is it verified and validated and applicable to other areas. Our ultimate intent is to be able to use a sort of file bin, leveraging system of data and artifacts to reduce the need for programs to have to duplicate this type of evidence. And then finally, we are very interested in the degree of reliability among all raters. That's a common problem for many of these systems, and it's one that we feel we're in a nice position to be able to analyze because we're able to track down to each specific rating that the various raters give, as well as what they do in various training simulations and scenarios. Finally, some lessons learned from the Maryland Excels experience on the next slide speak to many of the points that Ioma and Bobby and the great work that's happening in Mississippi have already raised. Having a great central data architect, actually in our case we have Phil Koshkin, who helps to ensure that across all of these systems we are leveraging and not duplicating, and that we are being consistent, and that the data is informing and feeding one another, both for identifying errors as well as to ensure that we're adhering to those common definitions that are so critical. Speaking to what Mike was addressing in Mississippi's process, clearly identifying needs and then looking at data collection mechanisms. Sometimes, particularly from kind of systems architect perspective, we can think, oh, we're going to build it this way and this is what we want. But first identifying the needs and then looking across your systems helps to prevent that duplication of effort or sort of over-engineering. And finally, getting down to that user perspective that everybody has spoken to. This version of the tool, as we move out with the Census Administration, will be version 3. We've modified it from the pilot to the field test, always trying to refine it to be the best interface for the end user in terms of ease, usability, and then ultimate accuracy of the data that they submit. So that's just a real brief example of what we've been doing here at in Maryland, and it's definitely an ongoing and evolving process, but in the end it makes analyses and then justification of the QRS system that much easier.
Thank you so much, Chris, and I want to just say thank you to both sets of our state panelists for the really rich examples. We were able to see in one state more of an example of the process and the different building blocks of their full system, and then turn to a second state and get in more detail about how this system, how the data governance in their system is working to allow the QRIS to operate and to address some of those problems that we heard about at the beginning of the webinar. And I think these examples really demonstrate the important connections that are happening between both states mentioned the importance of starting with those questions about what it is that is most important, what does the state need to know, and then developing those structures to get there. So hopefully these examples have provided some food for thought. And in the interest of time, I'm going to just keep us moving through our slides. Thank you for those of you who have given questions via the chat function. Because we're running so late with our webinar today, what we'll do is address your questions to our panelists, and we'll send those out to all of you so that you can see the questions that were asked and some of the answers. But I'd like to just take a few minutes to wrap up. We have, as I mentioned at the beginning, our final webinar in the series, which will be on best practices for producing high-quality data. That will happen on May 16th at 2 o'clock Eastern. Again, you can go to researchconnections.org, and there is an INQUIRE tab at the bottom right-hand of the screen. If you need to find the registration link for the webinar, it should be on the INQUIRE page on Research Connections. And you heard many examples today in this webinar about data quality and some of the procedures that need to be in place to produce high-quality data. This will be a webinar devoted exclusively to that topic, again, looking at it within the context of QRIS. And then before we wrap up, I'd like to just acknowledge the many, many people, including, of course, all of our wonderful panelists today who participated in the webinar, but also the group of contribute is to INQUIRE's data work group. And you can see the list here. I will just read through Rick Brandon, Missy Kokenar, Ioma Iruka, Tabitha Eisner, Fran Kipnis, Lee Schrader, Min Lee, Lisa Malone, Francis Majestic and Elizabeth Hoffman, Dawn Ramsberg, and Bobby Weber. And some of these names represent our federal partners who are helping us as we work on INQUIRE data to make sure that our efforts are connected with other agencies and that we're addressing some of the questions that we're hearing, not only in quality improvement initiatives, but as we saw in some of the examples, how we're connecting to other important questions outside of early childhood as well. And then if you can just move us to our contact information, as you can see, there's an email address here for me and as well for Evelise Martinez-Speck. If you have any questions or want to provide any feedback on the webinar, we would really appreciate hearing your thoughts. And we look forward to talking with you again on May 16th. Thank you so much for your attention today, and thank you again to our wonderful panelists.